thumb sucking. Is thumb sucking a normal? Till what age can a child suck the thumb? What are some of the problems that can happen because of thumb sucking? What can be done to correct it? All these are some of the questions which we will be addressing in this particular video, because this is one of the commonest questions people ask us, right? As a dentist, we usually get these questions asked very frequently. Let's address in this particular video. Hello all, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Raja, Namalipuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. When it comes to thumb sucking, what we need to understand is, for infants, for babies and infants, thumb sucking is a normal, natural phenomenon. There's nothing to get worried about. It helps in the, it reinforces the suckling reflex. It helps in the normal mental and psychological development of the baby. So if a baby is 1 year, 2 years sucking the thumb, don't worry, don't panic. There is no harm that will be created in the first 2 years of their life. So usually as the baby grows into the 3rd and the 4th and the 5th year of their life, so they drop the habit. They don't continue the habit into the younger age. Only a few percentage of the children continue this habit into the younger age. When they continue to the habit into the younger age, what can happen is, typically the first effects are seen in the upper teeth. The upper front teeth can get proclined and the upper palate can also get deeper over a period of time. So usually the front teeth doesn't look good because they are very proclined front teeth. These are some of the problems that can happen when the child continues the habit. At this stage, it's very important parents play a very crucial role, have a very supportive environment for the child to give up the habit by gently informing the child the benefits of not sucking the thumb, how good their teeth are going to look. It's very important at this stage parents play a very supportive role for the child to ensure that the child leaves this habit. So, and usually but sometimes the child continues the habit post 6. But what we need to understand is, any harmful effect on the teeth or the development that has happened by the child sucking the thumb till about 5 years of age is usually gets reversed as the child grows into an young adult. So till 5 years, nothing to worry, but post 5, say if the child continues, then we will have a developmental issues that is happening on the jaw. So what can happen? Upper teeth, as I said, can get proclined, the palate can get whittled deep, and because of the effect of the thumb on the lower jaw, can prevent the lower jaw from going normal, can then cause a retruded jaw position. So these are some of the effects that can happen if the child is going to continue sucking the thumb even after 6 years of age. So there are simple appliances that are available which will help to prevent this child from forming this habit. What is very important in this particular case is, it's very important that parents and all the people who are there in that environment play a very supportive role to the child, not ridicule the child, not make fun of the child. Because ridiculing the child and making fun of the child will only worsen the habit, prevent them from actually coming out, because they have a certain sense of a satisfaction in doing that. They feel a secure environment when they do that. So ridiculing the child will prevent them from coming out of the secure environment. But playing a supportive role for the child, giving a very secure environment for the child, will help the child to come out of this habit. Hope you like this video. If there are any questions, please do ask in the comment section below. Do subscribe to our channel. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.